Let's look at some solutions to cardiovascular disease. Plaque busting drugs or clot busting. A simple method that's been around for many years is nitroglycerin. You can dilate the coronary arteries, the arteries on top of the heart, and that can work. Or there are plaque busting drugs, which TPA is one that comes to mind. Because, there's a embolus on the video, and it's held together with fibrin. And so TPA is going to bind to the plasmagen and cause enzymes to break down the fibrin. It's so cool. And that clot is going to dissolve. All right. So that's a happy story. It has to be done quickly, though, because we have phartic tissue that's going to die, or it's dead, and penumbra tissue that is at risk. So all this has to happen very quickly in transport, really. You can't wait until they're at the hospital sometimes, or it is too late. Angioplasty. If you go to a cath in a hospital, sometimes they'll allow you to watch. The dye is inserted so that the physician can detect the position of the catheter. The catheter is going to go into the vein, often inserted through a femoral blood vessel. A balloon is inflated and it's going to press down the plaque, and then a stent. The new stents are of a material that discouraged plaque, because in the old days plaque would build up in these stents, and then we have a blocked lumen once again. Okay. Bypass, just like the word suggests, we have a blocked, if you look at the far right, you see this darkened area, same here. That is where the atherosclerosis is so advanced that there is no longer blood flow. It means the heart downstream, the muscles here, myocardium, is going to die unless we bypass it. Now the body will try to make its own bypasses, but it's often too late. One of the best sources is the internal mammary, because it does not become narrow over time. We use the radial and the greater saphenous. The saphenous is a vein which collapses easily, but it's been used for many years. Off pump. Okay, what's done in off pump is, let me show you the standard way of doing a coronary bypass. Is there's a machine, a heart pump, really. Here it is, where we're going to keep the heart alive, but with a off pump, the technique is done while the heart is still. Now there are some risks to this, but there's a lot of advantages as well. So that's the off pump. Varicose veins, the technical name is chronic venous insufficiency, because the way the veins are, at the far right, this is a healthy vein with the valves that prevent backflow. We want blood going in one direction. But what happens is, as blood begins to pool and collect above the valves are going to stretch, and it worsens over time. Spider veins, they're unsightly perhaps, but not a health risk. Many of us will develop these as we age. Varicose, we're looking now at the valves I'm talking about here. That's true varicose. Spider veins aren't varicose. I talked about the weakened walls, the veins. Sometimes compression socks and exercise elevation can treat stage 2 and take it backwards to stage 1 or stage 0. What we don't want to go is to a stage 3, because here they were going to require something like vein ablation or something more serious like stripping. In ablation, a catheter is used and then a laser beam, and we just seal those off, and then new blood vessels form. We get ulceration in stage 4 and 5, and these could be life-threatening. Okay, all sorts of serious infections there. So it's one of those disorders that can be serious. depending on the degree. Arrhythmia, irregular heartbeat. We measure these with a ECG or EKG, either way. I mean, it's the same thing, but the acronyms are different for depending on where you work. Okay, we have a SA node, sinoarterial, and the atrioventricular node. The SA node sends out the main impulse. The AV is going to collect the impulse, slow it down, and distribute it in the ventricles. All right, so that's how it's supposed to work. And we do have a good example here of the P, QRS, and T wave of a healthy rhythm. Now, in the case of AFib, it's a chaotic kind of electrical impulse under the category of tachy. Tachy is 100 heartbeats or more, not induced by exercise. All right, so that means they're sitting there in a chair and they're above 100. Flutter has a little more organized, and you can see it here. It's close to resembling a healthy ECG, but those QRS peaks are a little too close together. It can be mild or serious. It depends. One of the problems I'll tell you right now with any kind of arrhythmia is blood is supposed to move in one direction. And if it hangs up because of arrhythmia, it's going to form clots. And I've had patients where, I do a blood draw and I'm waving goodbye to them, and I'm looking at their blood in the vial, and it's already clotting. All right, so blood has to move or it tends to clot. And that's why when people were worried about the COVID vaccine and clots, I thought, well, all sorts of situations cause clot. Yeah, it's hard to say why blood clots. All right, ECG of P waves, and they're replaced by Fs. Now here we have a true afibrillation because the P's are gone. All right, so here's a normal. If you're wondering what I'm talking about, P, QR, S, and T. This is what we like to see, healthy patient. In the case of AFib, we have a bunch of F waves, bam, bam, bam. And what that means is the heart is not pumping adequately. And so there's a long-term problems with that. Okay, bradycardia is slow. And we often don't worry about this because athletes, runners, they could be 60 or below. But if it's due to a SA or electrical node situation, then we start to worry. It's interesting though, if the SA dies, then the AV takes over at about 40 to 60 beats per minute. It's funny, the heart does not want to die, so it's got a backup system. Yeah, that's cool. Okay, tachy. Tachy means fast heartbeat. I was talking about the atria. Okay, remember the atria on the top of the heart chambers here? But ventricular tachy, that is more serious than atrial because look at these muscles, massive. They're going to pump blood to the lungs, and they're pumping blood to the body, all the way to the tips of your toes. So we're talking enormous power of pumping in the ventricles. So if these guys aren't pumping adequately, then we can have a serious problem. It can be transient, which happens. You probably have had some VFib at some point in your life. Your heart started beating like crazy and you got scared. But that's just tachycardia. Who cares? But ventricular fibrillation, that is due often to chaotic electricals. We call it VFib. And it can be fatal because, well, here's an example. When we have VFib, because look at a normal. Okay, we're filling the atria, then we're filling the ventricles, and we're pumping it to the body, and we're filling the atria, filling the ventricles. Okay, this rhythmic pumping makes sure we have adequate blood to all of our tissues. Okay, glucose, oxygen going everywhere. In this case, it's just spurting out of the heart, and the blood volume is not adequate. And so we have to act fast. Now, an AED can reestablish the electrical impulse, but you got to know what you're doing, because I mean, if the patient's wet and you're wet, and it could be threatening you, and your welfare comes first. Also, an AED does not replace CPR. Okay, so we attach the pads properly. We listen for the signal, and if it tells us to do chest compressions, whatever it tells us to do, we do. But you got to be ready to do CPR. You can't just stand back and think that that machine is going to take care of everything. Endocarditis. Okay, endo means internal. And this internal tissue sometimes gets inflamed, such as the valves, especially that mitral valve. So we're on the patient's left side, and sometimes Staphylococcus bacteria will get in there. And that's why when you have a patient who has a history of heart disease, sometimes they're prescribed antibiotics for any kind of procedure that's even slightly invasive, like dental cleaning, because once the bacteria get in there, now we have a serious situation. Rheumatic fever is similar, but it's a strep, which is a chain of bacteria, versus a clump, which is staph. In this case, the body's own defenses will attack the staph that's infecting the valve, but they go too far. Our own immune system is going to attack our own valve. Now, we don't see this too often in developed societies. Children 5 to 15 in underdeveloped countries. Yeah. Myocarditis, think of muscle tissue. So the middle layer is the myo, and that's the main pumping muscle. Then the epi is on the outside, protection, and on the inside. Okay, viruses tend to be the ones that cause inflammation of the myocardium, but some people will overdo the cocaine, or they'll take shots of alcohol or other substances that cause the heart to become inflamed. And that's a sad situation.